Measles is a highly contagious infectious disease which is caused by measles virus. Initial symptoms typically include fever, often greater than 40 degrees Celsius, cough, runny nose, and inflamed eyes. Measles last for 7 to 10 days, and first symptoms occur 10 to 12 days after exposure to infected person. The classic symptoms include a 4-day fever, or the 4Ds, and the 3Cs, the cough, coryza or head cold fever sneezing, and conjunctivitis or red eyes, along with a maculopapular rash. Fever is common and typically lasts for about 1 week. The fever seen with measles is often as high as 40 degrees Celsius. A red, flat rash is common, which usually starts on the face and then spreads through the rest of the body. Typically begins 3 to 5 days after the start of the symptoms. The characteristics of measles rash is classically described as a generalized red maculopapular rash that begins several days after the fever starts. It starts on the back of the ears and after a few hours, spreading to the head and neck before spreading to cover most of the body, often causing itching. The measles rash appears 2 to 4 days after the initial symptoms and lasts for up to 8 days. The rash is said to stain, changing color from red to dark brown before disappearing. Overall, measles usually resolves after about 3 weeks. Small white spots or Kuplik's spots inside the mouth is the characteristics of measles, which occur 2 or 3 days after the start of the symptoms. Measles' other names are morbillia, rovillia, red measles, and English measles. Rovillia, also known as German measles, and Drusilla are different diseases. Measles is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of infected people. It is extremely contagious. 9 out of 10 people who are not immune and share living space with an infected person will be infected. People are infectious to others from 4 days before to 4 days after the start of the rash. It can affect people of any age, but sometimes it is called childhood disease. Most people do not get the disease more than once, and once a person has become infected, no specific treatment is available, although supportive care may improve outcomes. Such care may include oral rehydration solution or slightly sweet and salty fluids, healthy food, and medications to control the fever. The risk of death among those infected is about 0.2%, but may be up to 10% in people with malnutrition. Most of those who die from the infection are less than 5 years old. The measles vaccine is effective at preventing the disease and is exceptionally safe. Measles affects about 20 million people a year. It is one of the leading vaccine-preventable disease causes of death. In 1980, 2.6 million people died of it. Complications of measles. The common include diarrhea in 8% of cases, middle ear infection 7%, and pneumonia 6%. These occur in part due to measles-induced immunosuppression. Less commonly are seizures, blindness, or inflammations of the brain may occur. Laboratory diagnosis of measles can be done with confirmations of positive measles, IgM antibodies, or detection of measles virus RNA from throat, nasal, or urine specimen by using the reverse transcription polymerase chain reaction assay. Clinical diagnosis of measles requires a history of fever of at least 3 days and at least one of the following symptoms: cough, coryza, or conjunctivitis. Observations of Kuplik's spot is also diagnostic. So, how we can prevent measles? Mothers who are immune to measles fast antibodies to their children while they are still in the womb, especially if the mother acquired immunity through infection rather than vaccination. Such antibodies will usually give newborn infants some immunity against measles. But these antibodies are gradually lost over the course of the first 9 months of life. In developed countries, it is recommended that children be immunized against measles at 12 months, generally as part of a 3/4 MMR vaccine, or measles, mumps, and rubella. The vaccine is generally not given before this age because such infants respond inadequately to the vaccine due to an immature immune system. A second dose of the vaccine is usually given to children between the ages of 4 and 5 to increase rates of immunity. Adverse reactions to vaccination are rare, with fever and pain at the injection site being the most common. Life-threatening adverse reactions occur in less than 1 per million vaccinations. There is no specific antiviral treatment if measles develops. Instead, the medications are generally aimed at treating superinfections, maintaining good hydrations with adequate fluids and pain relief. Young children and the severely malnourished are also given vitamin A, which acts as an immunomodulator that boosts the antibody responses to measles and decreases the risk of serious complications. Treatment is supportive, with ibuprofen or paracetamol to reduce fever and pain, and, if required, most people survive measles, though in some cases, complications may occur. About 1 in 4 individuals will be hospitalized, and 1 to 2 in 1,000 will die. Pneumonia is the most common fatal complications of measles and accounts for 56 to 86% of measles-related deaths. To achieve herd immunity, more than 90% of or 95% of the community must be vaccinated due to the ease with which measles is transmitted from person to person. In 2011, the WHO estimated that 158,000 deaths were caused by measles. This is down from 630,000 deaths in 1990. As of 2018, measles remains a leading cause of vaccine-preventable deaths in the world. As a result of widespread vaccination, the disease was declared eliminated from the Americas in 2016. However, there were cases again in 2017, 2018, 2019, and 2020 in this region.